just welcoming you again and thanking you for taking the time. I know you're each busy and I appreciate the time that you're taking. We've been excited about the prospect of having you on the call in order to let you know what we're up to here at Father Joe's Villages, and you'll see that it's a lot as always. And just as importantly, to speak about the state of homelessness here in San Diego as a whole. And so we'll talk about those. And I'm Deacon Jim Vargas, for those of you who don't know me, and I'm the president and CEO of Father Joe's Villages. And with me is Bill Bolstad, and he's our Chief Strategy Officer. You'll be hearing from him in the second half of this presentation. He'll walk us through our strategic plan that we have in place and solutions to this crisis that we have, frankly, in San Diego as it relates to homelessness. Let me just mention, as far as questions are concerned, please, we encourage you to ask questions. There's the Q&A, there's the chat feature that you can access down on your screen on the right-hand corner of the screen, the bottom. And by all means, submit your questions there. And then at the end of the session, we'll allow time to be able to answer those questions. And I do encourage you to ask questions. So let's look back at 2021. Let's talk about some of our successes. And our successes are only possible because of your support. So let me start there. Thank you so very much for believing in us and believing in the potential of those who we're blessed to serve each and every single day. So thank you for that. And there have been many successes even in the midst of this pandemic, right? So it's been important for us to be out there continually because it's been an ever-growing need, and I'll talk about that when we discuss the increase in homelessness within San Diego. We've been able to expand and continue our programs and meet the immediate needs of the most vulnerable, frankly, within our community. Within that process, we've been able to complete 400 new units of affordable housing in San Diego. And also in 2021, we were able to serve, as you see from the screen, we were able to serve 12,000 San Diegans who were struggling in one fashion or another with homelessness. And you see on the screen itself that it's really across the board. It's a cross-section, whether they were families or veterans, children of all ages, all genders. I mean, it's just across the board. We're blessed to be able to do what we do. On any given night, we provide some level of housing to over 2,500 individuals. And you'll see that as we look at our four pillars. The four pillars pretty much represent comprehensively the work that we do. And the first one that you see there is just basic. I mean, and it is impossible for a person to focus on taking the steps to overcome homelessness when their time, energy, and resiliency are concentrated on just survival. And so the fact that we're able to provide shelter and housing for 2,500 people each and every single night, over 2,500 actually, it really makes a difference in the lives of these individuals. They're able to feel safe as a result of it. They're able to realize then that they have a place where they can take a shower, where they can, the things that we take for granted, that they will have meals, right? So then they can focus on addressing their issues, whether they have health issues, substance use disorder issues, as an example, mental health issues. They can then focus on that, and they, as a result, we can help them to prosper. And speaking of health, which is one of the other pillars there, you'll notice the numbers there. I don't need to repeat those numbers, but one of the things on which I like to focus is our street health program. We were the first ones out there doing street health here in San Diego. It started the year before COVID in about the middle of 2019. And the reason we were out there is because, and we continue to be out there, is because we realized that about 30% of those who are homeless and on the streets won't access medicine and healthcare in a traditional way, in brick and mortar. So we wanted to go out and meet them where they are, bind those wounds, dispense medication if they needed medication, blood pressure medication as an example, whatever they needed in order to start building relationship. And that's extremely important. We're in the hope that through relationship building, then they would come in and access additional services. And we've seen that since 2019, we've seen that that has come to fruition. This year, we've added psychiatric clinicians, in fact, to the to the mix of those who are out there in street health. And so it's an important element. And then our children, those who come to us from homeless families, these children are academically, emotionally, and socially delayed. And they are 4 times more apt to be homeless in adulthood unless we mitigate their circumstances. So the child and family services intervene and prepare a child for long-term success with comprehensive services, including childcare assessments and targeted behavioral interventions, parent education groups, after-school programs, and tutoring and academic services. We served, as you see here, over 900 children in about 450 families. And so it's an extremely important pillar of our organization. And then there's strengthening self-sufficiency. Father Joe's Villages empowers our neighbors through the Employment and Education Center and the chaplaincy services. Employment and Education Services provides education on job interviews and applications, and provides training for computer and on-the-job skills, from classes to certifications to one-on-one mentorship. So it's another element which is extremely important. We know that with training, with and marketable skills comes employment, and with employment comes income, and then that leads to self-sufficiency. So it's extremely important. Nearly 700 of our neighbors who we were able to support participated in this program. So let me tell you about Albert, one of our clients, because I heaven knows I have many data points in my mind that I share constantly with people. I always have to remind people, though, that behind each and every single one of those numbers are individuals. And these are individuals who have different circumstances in their life for one reason or another. Maybe it's been economic circumstances that have thrown them into homelessness. Maybe it's been health. Maybe it's been mental health issues, substance use disorder, whatever it is. They all have different paths. They all have different journeys. And because of that, it is extremely important that we, as a result, make sure that we target our services to the needs of the individual. Albert is someone who, and you see him here in his new home, in his apartment. Albert is one who is a resident at our newest development on the corner of Commercial and 14th Streets. It's called St. Teresa of Calcutta Villa. We cut the ribbon on that facility in early February. We started moving people in January. We are now completely leased as of last week. 407 homes that are completely leased, providing shelter and more than shelter, apartments, and as I say, homes for about 500 individuals, because it services not only singles, but it services families as well, and you'll hear more about that. So Albert is someone who, when I first met him, he showed me a picture of his mother with Mother Teresa. When he was a child, his mother worked at a church parish, and Mother Teresa happened to come to that church. And so his mother was introduced to Mother Teresa at the time, and there was a picture taken. So this is a photo, as you can imagine, that Albert treasures, and he's always kept it with him. Well, Albert, because of different circumstances, started using drugs when he was a teenager and into his early 20s, and he really had difficulty supporting himself. He had difficulty basically maintaining a home. In time, he fell onto the streets, and he continued to struggle for quite a while, actually. And yet his faith never wavered. Albert's mom passed away, actually, while he was in prison. He had been incarcerated because of a particular crime. It was a minor crime, but in any case, it was a crime. And he had been incarcerated. And while he was in prison, his mom passed away. And that's what really brought him to his knees, when he realized that he wasn't even there for his mom's passing. So when he got out of prison, he decided he would clean himself up. So he went into a rehab center, and that helped him tremendously. And it's a continual struggle with him. Obviously, he's been struggling with substance use disorder for 40 years at this point in time. He was going by our building as it was being constructed, and there was a big sign that says, "Hope lives here." As he looked at it and wondered about that, it just struck him, that sign, "Hope lives here." He came and inquired about it, and when he learned that the building was to be called St. Teresa of Calcutta Villa, well, he just thought that was a sign that his mom was sending him. And so he came in and applied and he was approved for one of the units, one of the homes. And he now is living, there isn't a time when I go into St. Teresa of Calcutta, and I do so quite frequently, where he's not just eternally grateful for the opportunity. He calls it his little, a little part of heaven is what he calls his place. And so that's Albert, and there are many Alberts, and I'll share another story with you in a few minutes as well. But that's why we do the work we do. We do the work because it makes a difference in the lives of individuals. Due to the work of the incredible staff and the support that you give and that you've given in 2021, and some of you have been longtime supporters, we're able to make those strides in preventing and ending homelessness. In the last 10 years, we've been able to help more than 12,000 people into permanent housing. And it's not just a matter of helping people into permanent housing, it's the comprehensive services that go along with that, that continue, that help individuals to retain their housing long-term. 95% of those who we help into permanent housing retain the housing long-term. And that's what it's all about. So as we move to the next section of our presentation, I want to talk to you about what we call, or what is called, the point in time count. Some of you may be aware of it. In every major city in the United States, once a year, there is an opportunity for a region to be able to basically scan the entire area, the cities and the counties, and the entire county, in order to determine how many homeless are out there. In San Diego, it was done at the end of February. There were about 1,500 individuals who canvassed basically a lot of the areas, the ravines and canyons and so forth, the city streets. And as a result, we arrived at a number. The community arrived at a number as far as homelessness is concerned. The Regional Task Force on Homelessness is the one who conducts this survey each and every single year. And it's required by HUD, the Federal Department of Housing and Urban Development. The HUD uses this snapshot in order to allocate funding to the various cities. So it's an important number. No one, by the way, would say that it's a 100% number, that we've captured each and every single one who's out there. That's unrealistic, right? But the methodology is consistent from year to year. So relatively speaking, it's a good barometer. We do know that in addition to the number, and I'll share, and you see the number on the screen there, in addition to the number, that about last year, about 35,000 individuals touched some aspect of the homeless system within San Diego, right? So we know that it's a lot more than that point in time. But again, it's useful. It's a useful barometer, a data point, and it's used for HUD. Well, this year, as compared to when it was taken 2 years ago, it was not taken last year because of COVID, but as compared to 2 years ago, the number grew by 10%. It was at about a little over 7,600. It's grown now to somewhat over 8,400, as you see on this screen. I always like to point to some positives. All right, so let me point to those first, and that's that there's been a 30% decrease in veteran homelessness, and that's great. That's great. And there's been a concerted effort over the last few years focusing on veterans, and as we can see, it's bearing fruit. There's also been a 7% decrease in chronic homelessness. Chronic homelessness are those individuals who have been out there for an extended period of time or have fallen into homelessness multiple times. And so that's good to see as well. That said, the overall number increased by 10%. And the number includes over 4,100 who are unsheltered. Quite a lot of people who are unsheltered in San Diego. Not a good thing, obviously. And you'll see some of the other numbers. I don't need to repeat them there. But these results are frustrating, as you can imagine. It's frustrating to us as a service provider. It's frustrating to other service providers. Heaven knows we all work very hard to make a difference in the lives of these individuals and improve the community. So we have to ask ourselves, why is homelessness still increasing? I mean, and we believe at Father Joe's Villages that there are a few key factors contributing to just that. Why is it that homelessness is still increasing in San Diego? And some of this won't surprise you. It isn't rocket science necessarily. So I want to share a few key issues with you as obstacles that we see preventing homelessness, as well as solutions that are included within our strategic plan and beyond. So let's talk about affordability in general. There is that we know, we experience it, that here in San Diego, it's a very expensive place in general. And as far as housing is concerned, it's extremely expensive. San Diego rents in 2022 are up by almost 20% compared to 2021. That's quite substantial. And we know that the average apartment is renting for more than $2,700 a month. Many San Diegans struggle simply to keep a roof over their heads. A person working for a full-time minimum wage job makes $2,600 a month before taxes. Yet the average cost of a studio apartment in San Diego is $2,000 a month. That means they would have to spend 77% of their gross income on housing alone. It's not tenable, right? It's not tenable. So it throws people onto the streets. And then what you add to it is inflation. Our low-income neighbors are becoming even more squeezed by inflation. San Diego consumer prices are up 8% just about from a year ago. There are families entering into dire situations, forced to make decisions between critical line items like food or housing, gas or healthcare. Inflation plus housing costs are squeezing low-income individuals and families so that there's no room for random events in their budgets. Their lease ends, their rent increases outside of their budget, or unexpected medical event happens, or job loss. If this happens, it could be impossible for the household to find new housing at a price they can afford, launching them onto the streets and into homelessness. If you ask our outreach workers, the outreach workers at Father Joe's Villages, they'll tell you that substance use is the #1 problem causing suffering and devastation on the streets of San Diego. Approximately 35% of all unsheltered adults who are homeless have chronic substance use issues. People who are homeless experience substance use disorder at a rate more than twice as high as the average person. Oftentimes, substance use begins as a way to cope with mental illness and the stress of poverty. People often are facing unaddressed acute trauma from childhood, military service, or even their time on the streets, and experience a cycle of depression and self-medication as a result. During the pandemic, substance use only got worse. While numbers haven't been released for San Diego, the LA Times reported that overdose deaths within the homeless population increased from just over 400 in the pre-pandemic year to 715 last year. One of the most significant effects of substance use is that it prevents people from seeking the help they need. Too often, people refuse to come into our shelters or take advantage of our programs because they want to remain where they can find their dealers, or because shelters don't allow them to bring drugs inside. So, as a community, San Diego needs to prioritize a diverse set of models that employ same-day resources, empathy, and a medical understanding of substance use disorder. And we need to build out these resources on a much larger scale. One of the things that I mentioned earlier was our street health program. And Bill Bolstad, when he comes up in a few minutes, he'll be talking about medication-assisted treatment. That is extremely critical to help individuals to start weaning themselves off of substances. But it's a matter, it needs to be timely. If someone decides, hey, you know what, I want off of these drugs, then we need to be available to assist them in the immediacy. And that's actually what the street health program does and our health center does. If you come into our health center and that's what you want, you have a same-day appointment. It's not a matter of, okay, we'll come back tomorrow, come back next week when we can fit you in. You have to seize the opportunity, and that's the only way that you can be effective in these individuals who are struggling and suffering. So there are 20 to 25% of people experiencing homelessness in the US suffer from some form of mental health issue as well, such as depression, bipolar disorder, schizophrenia, and other illnesses. Sadly, mental illness can also prevent neighbors from entering shelters and accessing services that can end their homelessness. Oftentimes, despite best efforts by our outreach teams, service providers must stand by and watch if a person does not have the capacity to accept help. It's really distressing. Unfortunately, neighbors who are seeking help have difficulty finding it due to the lack of services in the community. It's been reported that patients waited an average of nearly 14 days for post-hospital behavioral health care in 2018, a number that has been steadily increasing since 2014. Although similar data is not available for 2021, we know that the need for behavioral services and understaffing has only increased during the COVID-19 pandemic. Across federally qualified health centers in San Diego, and we're one of those, there has been a significant wait list for getting therapy appointments due to staffing shortages and an increase in community need. Doing nothing means some of these individuals will die alone on the streets, but often providers' hands are tied in terms of intervention. That's why Father Joe's Villages supports court-level interventions that offer intense behavioral health and substance use disorder treatment services in place of incarceration. We're also advocating for increased behavioral health services across the community and conservatorship options for people who cannot take care of themselves due to serious mental illness. Care Court, you probably heard about Care Court. It's a proposal before the California Assembly at this time, which would allow a civil court to create a voluntary or court-ordered care plan and implement services to provide behavioral health care, medication, housing, and other services to adults who are suffering from schizophrenia spectrum and psychotic disorders who cannot take care of themselves. Care Court or a similar service-based court would be a great first step to offering new tools to service providers and justice systems to help people access critical and life-saving behavioral health services right when they need them most. It's very controversial. Our freedoms are sacrosanct, and well, they should be in this country. We live in a great country, and our freedoms are very important. So we shouldn't take lightly something like a conservatorship. We need to make sure that we are being, as community, as prudent as possible, so that it's not just a matter, it isn't just that we're taking people's rights away, but it's for the purpose of helping them for the long term. I don't believe it's moral. I don't believe it's right to leave people on the streets who we see cannot help themselves and are suffering and are dying, because literally people are dying on the streets. More than 100 individuals die on the streets here in San Diego each and every single year. So this coming week, we will be releasing a report that goes into greater detail about these issues, how they contribute to homelessness and the solutions. Please be on the lookout for that report in your inboxes. We'll make sure that you receive that. So with that, I do want to reintroduce Bill Bolstad. Bill Bolstad has been with our organization a good number of years. He is currently the Chief Strategy Officer, and I've alluded to solutions. I've talked about some of those. The strategic plan that we've put in place is chock full of them. And so Bill, take it away.
All right, thanks, Deacon Jim. I appreciate that. And good morning, everybody. Almost good afternoon. Good morning, everybody. Thanks for being with us today. We appreciate it. And as Deacon Jim said, I am the Chief Strategy Officer. That means that I have the privilege of overseeing a number of key facets of the organization. But one of the duties that I undertake every 5 years, I suppose it is the overseeing of putting together our strategic plan, which is something that we engaged in last year at the close of our prior 5-year strategic plan. So I do want to talk to you a little bit about that. Before I do that, let me just a quick note of housekeeping, just to remind you, in case you were so riveted by what Deacon Jim was saying, you forgot. But down below at the center of your screen, we do have a Q&A function, and we do want to encourage you guys to take advantage of that. We love questions. So if there was anything that as you were listening to Deacon Jim, you thought, oh, I wonder about this, or as I'm talking, if you have questions, please go ahead and click on that button and submit those questions, and we'll take some time at the end to answer them. So as I think a little bit about the strategic plan, just by way of introduction and on the importance of it, I would start, I guess, by saying that the work that we do at Father Joe's Village is trying to address homelessness is a daunting task, right? We constantly find ourselves under-resourced given the enormity of the problem that we're trying to address. So that means as a homeless services nonprofit, we have to be as strategic as we can be in the resources that we have available to us. And that's really the role of the strategic plan. It's there to help us focus in to try to anticipate those things that might be coming down the road, and also to think about how we can be most effective at delivering those services that the individuals and the families that we encounter need, and how to help them end their homelessness. So with that, let me talk a little bit about the specifics of our 5-year strategic plan. Let's see. So you have on your screen here, the first section here is a discussion about our innovation lab. So there's three facets that I'm going to talk to you about today, three facets of our strategic plan. Father Joe's Villages is the largest homeless services provider in San Diego. However, we really exist in a much larger ecosystem, if you will. And no one entity in that ecosystem can change the way that all of the homeless services system works. But at the same time, at Father Joe's, we have over 70 years of experience in this work. And we are blessed, I will say, with some of the top talent in the industry, people who are just as sharp as they come, who understand homelessness at the ground level and all the way up at the policy level. So the question that we asked as we were talking about the strategic plan and seeing the circumstances that Deacon Jim alluded to in the last section was, how can we take advantage of the experience of the organization? How can we take advantage of the expertise of this amazing staff we have to try to impact the broader system? And the innovation lab that you see pictured here is really the answer to that question. So there are a couple different facets to this. In the first box you see there, let me start by talking about the mini grants. We have staff across the organization who do amazing work, but work on very, very tight budgets. I blame it on being a nonprofit, but that's the nature of the beast. And so a lot of times there are things that they think, if I could just try this thing, if I had an extra $5,000 added to my budget or $7,000 or $10,000, I would love to try this new idea because I think it would help the clients really engage with us in a better way. But our budget doesn't always allow for that. So in this year's budget, we created these mini grants, is what we're calling them. Basically, it's an internal grant writing system. People write grants to an internal committee saying, hey, I had this great idea I wanted to try, and they kind of make their case. And then we select people, and we've allocated a small portion of our budget to do that, to allow those folks to try those innovative ideas out. And let's see how they do. At a macro level, we're also working on what we're calling demonstration projects. And I'll give you some examples of that in just a second. In both cases, the goal is effectively the same. It's to find gaps in the system and identify ways to address those gaps. And that's really what you're seeing in that second box, is really to create the best practices that we see are needed in our system. And then in that third box, you see that we don't want to keep that knowledge to ourselves. We want to take that information, go to the elected officials, go to the policymakers, take it to other service providers, and say, this is what we've learned. We had this theory and we tried it out and it didn't work. And here's why we think that was the case. Or we had this great idea and it really took off. Let us tell you how we met success. And in doing so, our hope through doing that is that we hope to change the way services are offered. And so that San Diego can create its own best practices that meet the needs of its individual communities. And at the same time that we can change the way the homeless services are provided for those on the streets. So let me talk a little bit about the demonstration projects themselves, and I'll talk about the first one, which is really an expansion of street health. You heard Deacon Jim talk about street health. It's obvious he's very proud of the program, and he should be, because this is an awesome program. What we're doing, though, street health, as he described, is really an effort to take the expertise, the expert care that we have in our village health center and take that out to the streets, helping people deal with, treating wounds, helping people deal with infections, helping them manage chronic disease. There can be a number of things that they do. But we realized a number of years ago that all of these things are available within the four walls of our health center. That's available on our campus. But many people don't come inside for just a variety of reasons. It could be that there's a distrust of healthcare. It could be that getting to the health center is inconvenient or difficult for them. It can be mental illness too, right? And mental illness, Deacon Jim kind of alluded to this, that sometimes by the nature of what mental illness is, in some cases, it can actually prevent people from seeking the care that they need. So street health gets beyond all of that. It's a way of breaking down boundaries. And we send this team of people out into the community and they can provide assistance right there on the sidewalk. So we've seen this program meet great success, but we know that we want to expand it. And one of the first things that we want to do is add psychiatrists. We're working right now to add a specialized psychiatric practitioner to the team, because we know that many people on the streets have those psychiatric needs. And again, if they're not coming into the health center or not coming into any health center, then they're not getting those needs met. So we want to meet them where they are, literally on the sidewalks. Another aspect of this is what we're calling the in-reach model. So you heard Deacon Jim talk a little bit about outreach, where we have teams of people going out to the streets and engaging with folks, trying to get them access to resources. But we found some experience with this a couple of years ago, and it was very successful, where there are a lot of people who, by nature of being chronically homeless, many of them on the streets, and by chronically homeless, I mean people that have been homeless for a long time, have been in and out of homelessness frequently over the last number of years. A lot of them have ongoing disabilities or chronic conditions they're contending with. By the nature of that condition, many of them end up in the hospitals or in the emergency rooms or getting picked up by ambulances frequently. In fact, there's even a couple of terms that are used. People call them super users or frequent flyers. And if you go into any emergency room anywhere, especially in an urban area, I guarantee that the nurses there know exactly who we're talking about. So InReach is really a model by which we engage with those hospitals, those emergency rooms, those EMTs, and we say, who are your frequent flyers? Who are the people that you're treating all the time? Connect us with them. And this is actually a partnership between Scripps Mercy and us and another homeless service provider named Path here in San Diego. Our goal by doing this is to connect with those individuals and to get them access to resources so that we can reduce that emergency room use, so that we can get their needs met. And I'll give you a good example of somebody where this occurred, just to kind of show you the power of this. Now, I have 4 children. I'll say that just by disclosure. I have 4 kids, which means that I have more reason than most to find my way to an emergency room. But I can tell you that even with 4 small kids, the last time I was in an emergency room was 2 years ago. And we had a client named Peggy. This was not that long ago. She, by contrast, had been in the emergency room 20 times in 1 year. That's almost twice a month, 20 times in 1 year. And she was admitted to the hospital 10 times. So we got engaged with Peggy. We provided intensive services. We helped get her housed. And what we found was her access to the hospitals stopped. She stopped going. She didn't need to go anymore. Now, that kind of use, going to the hospital, twice a month on average, roughly, is not good for Peggy or other people that are in that kind of situation. That means that their needs aren't getting met. They're just cycling in and out, in and out. And it's also not good for us as a community, because every time when Peggy goes to the hospital, she doesn't have the money to pay for the ambulance. She has no insurance. They're not paying for the hospital visit. That gets passed to the city, or the county, and gets passed on to us as taxpayers. So it's not good for anybody. In fact, the National Alliance to End Homelessness, which is a large advocacy group at the national level, estimates that the average person who's chronically homeless costs their community about $35,000 a year for these kinds of reasons. So it's really important. And actually, this kind of mirrors our own experience, our own health center. We provide triage care that helps prevent people from going to the emergency room. And based on the amount of triage care we provide, last year, we're estimating that it saved the community more than $4 million. Healthcare costs can be very expensive, which is no surprise to anybody on this call. So it's really important. This InReach model becomes a really important piece to the puzzle of how we help to prevent and improve situations for people on the street and prevent these kinds of costs from being incurred. So let me talk about another aspect of street health we're hoping to expand, which is really medication-assisted treatment. And Deacon Jim alluded to this one as well. Medication-assisted treatment is a technique specific for people that are dealing with opioid use issues, or maybe dealing with alcoholism. There's a few other drugs as well, but it's basically a combination of medication and behavioral therapies that are employed to help people either stop use, reduce use, prevent overdoses, and other negative effects of having used these substances. It can be very, very effective. But again, we offer medication-assisted treatment in our health center, but there are many people that are on the streets who aren't taking advantage of it, who absolutely could benefit from this kind of a service. So as we're expanding street health, one of our goals is to integrate that into the street health program. Within our health center, we provide medication-assisted treatment to about 200 people last year. Our goal is to expand that to 300, so it's an increase of 50%. Of course, we're always hoping to do even more, but that we thought would be a great start. And then it was interesting as we were looking at some of the data on this, and if you don't know this about Father Joe's Villages, I'll mention it now, that we are very data focused. So we have most of everything we have is computerized, right? All of our client records and whatnot. So we actually have a data team who looks at data all the time to try to help us refine our programs and look for areas of improvement. One that was noted actually in this specific area with regard to medication-assisted treatment is we noticed that for whatever reason, the segment of the population who are Black or African American were not taking advantage of this program proportionate to the percentage of people within the homeless service or within the homeless population. We don't know exactly why yet. So we're really looking to understand more about what's going on there, whether there's some stigma that's preventing people, whether people don't know about the program, they don't understand the type of program, the benefits of the program. So we're really looking to dig in on that and figure out how we can get more people to access it, more people that need it to access it. So I'd like to talk now about another one of our demonstration projects. This one requires a little bit of background to help understand it. So it's called the Family Empowerment Program. And just by way of background, a number of years ago, I'll say about a decade ago, the public policy at a federal level on how to address homelessness took a big shift. So prior to that, there was a lot of focus on what they call transitional housing. So people would go into a shelter for a year or two, and while they were there, they were surrounded by services. They'd work on finding employment, they'd work on addressing alcohol or use of other drugs. They'd work on mental illness, they'd work on other things that might be contributing to them landing on the streets. And then when they were ready, they would then go out and apply for an apartment. About 10 years ago, the federal policy shifted on this, and that affected local policy as well, where there was a greater focus on what they call housing first. So housing first was the opposite mentality. It said it's really hard to focus on all those things when you don't have a stable home, you don't have a permanent place to live. So why don't we focus instead on getting people into a permanent home, and once they're in there, providing those supports that they need to help them address the unemployment or the mental illness or whatever might be, whatever they might be facing. Like any public policy shift like that at a grand scale, there are segments of the population that benefit and there are others that don't. And so I'll just give you a couple of examples of that. Under the old system, those that were chronically homeless, like those that we're talking about, who many of whom are employed, but generally speaking are not going to get to a level where they're employed enough or making enough money that, oh, go back one, Sarah, that they're going to be able to pay for an apartment, especially in San Diego. And even if they did, there's ongoing support that they're going to need. The old system may not necessarily have given them the best tools to attract that. So under Housing First, that's a group that absolutely benefits and they're a prime focus of the Housing First movement. However, there's less of a focus on sobriety under Housing First. So what we see as a result of that is that in the city, in the county of San Diego, the region of San Diego, that all of the publicly funded shelters have more emphasis on bringing people into the shelters, on lowering barriers, so that if somebody is still wrestling with alcohol or use of other drugs, there's no barrier to them coming in. We'll say, oh, it's fine, you can come into the shelter. You can't use those things on site, but we're not going to prevent you from using them off site, and you come in, we'll help you, we'll come alongside you and help you in working through these issues. Again, that population benefits, but those who either don't contend with those issues or who are trying for sobriety, who are focused on being sober, it doesn't benefit them because there are fewer spaces now within the shelters for them to just focus on being sober, where they're not surrounded by other people who might be using. So again, pros and cons. We see the benefit to both. And at Father Joe's, so those are really important. We see the benefit to both. And I want to highlight one other aspect of this, which is that because Housing First has a heavy focus on people, especially the chronically homeless folks, get access to long-term rental vouchers. What we're seeing is an odd phenomenon within more and more people who are experiencing homelessness, where people believe that their best strategy to exit homelessness is to wait for some sort of government assistance. They're looking for that rental assistance. Our chief program officer calls it a culture of wait. And that's problematic for a lot of reasons. One is because most of those folks don't need that level of assistance. And two is even if they did, those resources are very limited. The vast majority of people who experience homelessness are not going to get hold of a voucher. It's just not going to happen. So we see this and we want to try to create a counterculture, one that reminds people that they have the power to overcome homelessness, that they themselves, a culture of empowerment, if you will. And that's really what the Family Empowerment Program is about. It's a demonstration project to start with, focusing on 10 families at a time. And it's really designed to try to create a culture of of lifting up people, helping people to focus on getting that long-term employment, getting that higher wage, focus on long-term housing and stability for themselves, and to focus on sobriety, right? So that other people in that same community, that group of 10 families, are all working towards the same kinds of things. And there are environmental things we're doing. We do intend to bring in intensive case management to help facilitate this as well. And we want to see if we can achieve the level of success that we think we can. And if we do, again, this is a demonstration project. It will allow us then the leverage to come to the public decision makers and say, this should be part of the ecosystem of services that we provide in San Diego, so that we can meet each client, each family right where they are and with the needs that they have. I do want to make a quick note on this in particular. Sorry, Sarah, one more. That's only possible because we have private funding. At Father Joe's Villages, we're about 2/3 funded through private donations. In order to try to create this kind of a program, if we were going to use public money, it wouldn't happen because it would require literally a policy shift. And in some cases, it could actually literally require an act of Congress. But because we have the private donations we do, it gives us the flexibility that we need to to meet the needs of the people on the streets where they are and the way that we see it needs to be done. And that's only possible because people support us in that way. Many of you on this call are among those supporters. So from the bottom of our hearts, on behalf of our programs team, we just want to thank you for the flexibility that you're giving us to meet the needs of our clients where they are. Okay, now we'll go to the next one. So kind of to that point, going back to our programs team then, and moving into a different section of our strategic plan. We've talked about homelessness at a high level, kind of a broad policy level, but the reality is, as Deacon Jim mentioned, there is a story behind every one of these numbers. And in order for that individual, that family to end their homelessness, they need a qualified, compassionate individual or team of individuals to meet them and to help them figure out how they're going to get out of that. So as we started to consider what we'd be focused on in the next 5 years, we recognized that what we need to do is really put a spotlight on our staff. How do we take care of our staff so they in turn can take care of our clients? So that's what you're seeing on your screen now, is that we are very focused on investing in care of staff measures and helping people develop their careers. We want to make sure that we're evaluating compensation each year. Nobody comes to Father Joe's to become rich, but we also need to make sure that they can pay the rent and that they can keep up with inflation and those kinds of things. And of course, we also have a high focus on making sure that we're aware that we want to invite everybody into our mission. So we want to be aware of diversity and equity and inclusiveness so that our staff and our clients all can be involved and that we're not unintentionally ruling anybody out of that. Okay, and then last piece, and I'll go through this quickly as we talk about turning the key. So we've talked about this before. This is our goal of providing 2,000 units of affordable housing for those who are on the streets. In the last couple of years, we've opened 2 buildings. The first was Benson Place, which is a motel conversion, and the second, as Deacon Jim mentioned, was St. Teresa of Calcutta Villa. Between the 2 of them, we've housed about 500 people. And so actually 500 units, nearly 500 units, more than 500 people. And you can see on your screen there that we have a number of people, 75% at St. Teresa are people living with a disability. So these are critical programs to help people off the streets and get them out of shelters and back onto their feet. Right now, we have 300 units in the pipeline for development, and I'll talk briefly about those projects as we're really excited about what's coming up. So the first one is 17th Commercial. This is on property that we currently own, where we have a maintenance facility that is now moving coincidentally into St. Teresa of Calcutta Villa. So we own the land and we are planning right now 108 units, studio apartments on this site. We're working through the financing right now. We're working through the design elements, but that is underway as we speak. The next project is actually an interesting one. It's at the corner of 16th and Island. This was a partnership, if you will, with God's Extended Hand, which was a collection of churches and ministries who were providing services to the homeless and unfortunately had to close their doors. But before they did, they came to us and said, we'd really like this land to continue to be used. So we'd like to contribute this to Father Joe's, and that's what they did. And so we are now in the process of designing a building on this site that will have about 100 to 125 units. And on the ground floor, we'll create space for God's Extended Hand to do some sort of ongoing ministry to people that are on the streets. On the same block, we had a for-profit developer named Liberty National Corporation, who is building market rate units in downtown, and as part of the requirements for the city, needed to build affordable. So they had actually acquired a site on the same block and came to us and said, we'd love to partner with you on this. And so that's what you're seeing pictured here before you. This is still in the early phases of design, but about 60 units there. And that's both 1 and 2 bedrooms. And we're now starting to focus on the financing stack on how we're going to get that built. And then the last one that I'll mention, what you see pictured here is an image of Benson Place that we've mentioned a couple of times. Benson Place was a motel conversion, our first one. It turned out to be a beautiful building, and it's a relatively cost-effective way to do this. It's much quicker and much cheaper than most ground-up construction. And so we'd love to do more of this. The David C. Copley Foundation was kind enough and saw our vision on this and agreed and provided a grant for $2.5 million to help support us in our next motel conversion. So we are on the hunt right now for a location, and that's kind of where that stands. So as you've heard, a lot of exciting stuff that we're working on at Father Joe's Villages, and we really appreciate the opportunity to share this with you all. I'm going to stop talking now and turn it back to Deacon Jim, and we'll go from there.
The host has to reactivate my video.
There we go.
There we go. Thank you. I'm sorry about that. Bill, thank you very much. A lot of information in a short period of time. So I appreciate you getting through it as you did. You know, I just want to not over dwell on that St. Teresa of Calcutta building, but let me just, it is a gorgeous building to look at. It truly is. You saw the actual picture of it a few slides ago. It's an extremely gorgeous building. We love to give tours. So anyone who's on the line and on this webinar who would like to come in and have a tour of the village, we'd love to host you on a tour. It is 14 stories, as Bill mentioned, 407 homes. And as Bill mentioned, it really, it helps a cross section of those who are homeless. There isn't a segment of the homeless population that is not helped by that building. There was a young man in a cap and a little girl on one of the slides when I was speaking. You may have noticed him and her. His name is Joseph. Her name is Abigail. She's 8 years old, and they are someone who also moved into Father Joe's Villages. He had fallen into hard times. He's a veteran and an extremely well-spoken young man. Fell into hard times onto the streets, basically, initially living in his car with his little girl. And with tears in his eyes, he told us how happy he was he could finally provide a home for his little girl. I mean, that's what it's all about. I mean, that's why we live in order to make a difference, a positive difference in the lives of individuals. And St. Teresa of Calcutta is one very important aspect of that. As I've said time and time again, yes, we may have more shelter beds than any other homeless services provider in the region. And that's extremely important because there's a lack of affordable housing. That said, a shelter bed is not a home. We must be developing, not only we, Father Joe's Villages, but the community needs to develop more affordable housing in order to really adequately and truly address the issue of homelessness. We tap the potential of those we're blessed to serve, and we reinstill hope in a better future. Hope is ultimately created by showing each person that they're worthy of something more. At Father Joe's Villages, we believe in each person's capacity for change. And every day I'm inspired to see people like you who join us in this belief. I can't thank you enough. Together, our work shows our neighbors that there are still people who care and who are invested in their futures, empowering them to become the drivers in their own lives and to take the steps to end their homelessness for good. So I thank you for being incredible supporters in this work. And what I'd like to do now is open it up to questions. And Bill, you're going to facilitate that part for us.
Yes, I am, Deacon Jim. Sorry. There we go. Okay, so we have a couple of questions that have come in. Let me start with the first one. It says, how many of people who are homeless are coming from out of state? There's a persisting rumor here that other states are giving free bus tickets to their homeless to California or Oregon. What percentage of the homeless have come across the border into the US? Deacon Jim, would you like to answer that one? I have my answer, but I'll give you the first crack.
Okay, well, I'll take a first crack at it. We're asked quite often whether those who are on the streets and are homeless here in San Diego fell into homelessness here. And the reason we're asked that question is that the thought is, well, it's such a great climate here, and we have such great services that would attract people to come from outside of the region and be homeless here instead of elsewhere. The reality is that consistently, year after year, when we ask the question in our surveys, about 85% of those who are on the streets have fallen into homelessness here in San Diego. The other 15% is not unusual. If you look at that same question that's asked in all the other major cities, that pretty much is the distribution, about 85%, 15%, even in New York City, right, where it's cold and who would want to be homeless there, right? So it's just, the 15% just represents that this population is a transient type of population, right? So they do move around, but the majority of the individuals have fallen into homelessness here in San Diego. Bill, is there anything you'd like to add?
Other just to say that is a common question. I've heard that asked in a national setting where there were people from all across the country in different cities, and every single one of them responded the same way, that they believed that people were coming from outside. Now, I will say that there is anecdotal evidence that it does happen sometimes. We have heard that off and on. When somebody might have gotten a ticket from Chicago or Las Vegas, that does happen periodically, but we don't think that it's systemic. It's not a common thing. There isn't a city that we've heard of that has a policy of sending their homeless people to San Diego. So another question that came in said, what policies would you recommend to get more builders to build more low and middle income housing? You want me to take that one, Deacon Jim, or do you want to
Sure.
take it?
Go ahead.
What policies? It's a great question. I think that for most for-profit builders are in the business of developing real estate because they can make money. It's a way of making money, right? So insofar as there are financial resources that incentivize people to build the low and middle income housing, then there's more reason to do it. What we're seeing consistently in places like San Diego is that there is a lot of investment in luxury apartments. It's very common because people can make more money in doing that. So I think that insofar as government can work to balance the scales a little bit, there are definitely mission-driven developers out there, but we need to make it so that it's financially viable for them. That would be my thought on how to do that. I don't know if there's anything you would add, Deacon Jim.
Well, and I just think it's an onerous process, right? I mean, we hear the politicians constantly speaking about the fact that we need affordable housing and that the process is going to be streamlined. I have to say that for the most part, we have not seen that. And so the permitting process, the regulatory aspect of it is very time consuming and costly as a result, because with time comes money. So we're always advocating for that to be addressed, basically, and the bureaucracy of it all. I'll share just a quick story with you. And again, it has to do with St. Teresa of Calcutta. That building, to look at it, you would think it's one legal entity. It's one building, I should say. It's actually two buildings. We had to bifurcate that building. And the reason we have to bifurcate the building is that we have been granted two $10 million grants by the state. And one was for veterans, as an example, and the other one targeted another aspect. Almost at the 11th hour before we closed, and we needed to start construction, we heard from the state that, they realized that we had gotten these two grants, but we could only have one, right? And there was really no logical reason for it, in our mind anyway, except because of their bureaucracy. So that was I'm blessed with an incredible and bright team. Bill is an example of that. And with our attorneys, we put our heads together and we decided, you know what, well, let's bifurcate the building because we don't want to leave $10 million on the table. And that's what we did. I've mentioned that to Senator Tony Atkins, who's toured the building. I mentioned it to Assembly Member Chris Ward, who's also toured the building, and a number of others. And each time I've mentioned it, it's been surprising to them. And my hope has been, hopefully they would go back and they would look at that and say, what happened here and what can we do to better it? I don't know if they will, but that's just, I don't want to belabor that, but it's just, it's frustrating for developers. I've had developers actually who have said they won't come into San Diego because of all the red tape and the requirements. Is just too onerous. And so anyway, enough said on that. Another question.
It's a good one. So is there an opportunity to connect the Innovation Lab work with academia or with the psychology, psychiatry professional associations? It seems like a great real world feedback data could be shared and leveraged. It's a great question. I don't know, Deacon Jim, how do you feel about that?
It is a great question. In fact, we've been having conversations with USD and UCSD and collaborating. And I think this is a good opportunity as we move ahead on the Innovation Lab, which is new to us. It's a new concept, obviously, as Bill mentioned. But as we move ahead, I see that as being a prime opportunity to be able to expand our collaboration with UCSD and USD, and maybe even bring SDSU into play as well.
Right, that's a great suggestion, yeah. Another person asked, what can the average person do to help improve the homeless situation? This is the $65,000 question. Go ahead, Deacon Jim.
Okay, what can you do? Well, first of all, I guess a few aspects. One is you can be advocates. Okay, you've heard a lot of what we shared, Bill and I have shared here with you today. Now you're, I dub you our ambassador. So you're able to go out now with this information, armed with this information, and be able to talk about this a little better, hopefully maybe a little wiser in a sense. You've gotten information you didn't realize. And so that positions you to be able to talk about homelessness in general and the part that the community needs to play as it relates to behavioral health. As an example, we mentioned that, which includes mental health as well as substance use disorder issues, as it relates to affordable housing and the like. Contact your council member, as an example. If you live within the city, contact your council member, contact your supervisors, the county supervisors as well, Nathan, Chair Fletcher, Nathan Fletcher. We work very closely with Chair Fletcher. So, one is we've raised your consciousness and your awareness. Now you're able to go out, talk to your neighbors and your friends, be a voice as far as the politicians are concerned. As far as helping Father Joe's villages, it's helping us directly, I should say. Obviously, you're committed to our work. You who are on the line are those who really have been faithful supporters of our mission and our vision, and believe in the potential of our people. So I would encourage that then you also encourage others to do the same, to come into the mix, join the family of Father Joe's Villages, volunteering as an example. We love our volunteers, right? Or buying in our thrift stores. Anything that's purchased there helps the community, and also it's a win-win, and then the proceeds go for services within our village. So I hope that answers the question somewhat. Bill, did you want to add?
I don't think I do. I think you covered it. That was great. I felt like they set us right up there to say, you just need to support Father Joe. So I appreciate that you had a much broader answer than that. We had another question here, and I think I'll probably take this one, Deacon Jim, if there's anything you want to add. It just asked, the 35% of homeless people who have chronic substance abuse, does that include or exclude those who are 20 to 25% who are mentally ill? And the answer is that those statistics likely overlap. How much? I don't know offhand, but they do definitely overlap to a certain extent. I don't know. Is there anything you wanted to add to that, Deacon Jim?
No, that's it.
Okay. So we had one about, there was a question about how involved we as Father Joe's are on the political side of rent control or decreasing evictions, etc. You want to take that one?
Okay, sure. And then by all means chime in. So the question is, what is our position as it relates to?
Well, how involved we are on the political side of rent control and decreasing evictions, which is, I understand why the question is being asked, given the focus that we have on keeping people housed and on creating new housing. It makes perfect sense. So it just kind of says, how involved are we?
Right. Well, we are. Well, let me first start by saying we are landlords. Mm-hmm. I mentioned we are developers. We are the landlord, as an example, with St. Teresa of Calcutta. We have a number of buildings, one on 16th and Market, and on El Cajon Boulevard in North Park. We have a number of others within our campus itself down on Imperial as well. So we are landlords. We do not like to evict individuals because we're all about getting individuals into housing. That said, it's very challenging. The nature of the population with which we work is a very challenging population. So as a result, sometimes we do have to evict, but we try that as a last resort. We have relationships with other landlords, and we utilize those relationships in order to be able to place our clients into their facilities, right? So there's that aspect of it as well, because obviously we don't have enough affordable housing ourselves. It's not just a matter of placing an individual with a landlord and walking away. If there's a need for some reason, or that the landlord feels, this is just not working out, we ask them not to evict the individual right off the bat, right? We work with the landlord, we work with the individuals, and more often than not, we're able to turn the circumstances around. Again, we don't want people to be on the streets. At the end of the day, though, there are situations where people do have to be put on the streets because it's not good for them, it's not good for their neighbors within the building itself, right? So I appreciated the eviction moratoriums that were in place during the pandemic. I think they were very, very necessary. They kept people in their homes. That said, those have been lifted, which is why one of the reasons I think we're seeing the numbers swell, those who are on the streets, and we expected that to happen. Rent control, I come from, those of you who recognize my accent, it's a New York accent, and I've been here 25 years, and rent control was very much, it is very much a thing in New York, and especially in New York City. And it's extremely helpful in helping people to gain housing and to keep housing. So that's something that I think we as a community, we should be looking more and more at something like rent control. So Bill, anything at your end?
The only thing I guess I would add is just in terms of our message about the eviction moratoriums, because going to the fact that we are a landlord, we kind of see both sides of the equation, right? I mean, Deacon Jim was mentioning that a little bit. In our messaging around all of the times when a rent control or when eviction moratoriums were extended or put in place or whatever it was, what we consistently said was that, yes, eviction moratoriums are important, but we can't forget the landlords. Like the landlords, a lot of them are smaller and this is how they're making, even if they're not smaller, there is a financial model here that functions based on rents coming in. So you can't just put the the onus of providing that relief on the landlords and say, you just can't collect rent. And that's not exactly, it's not what the government did per se. But that was our consistent advocacy, was that you need to look at both sides of this. We need to support the landlords and the renters. So how do we find the way to do that? We had another question here, and I know we're pretty much at time. Would you like to keep going, Deacon Jim, with a few more questions we have?
We can, and I would ask, I think I want to be respectful of everyone's time. I think the session was for an hour and a half if we needed it. That said, I don't know that we need the hour and a half. If we could do a few more questions, I think that would be great.
Okay, that sounds good. And I do want to remind people, if anybody has their hand raised, the best way to submit questions because of the format is to do it through the Q&A down at the bottom. So if you'd be willing to do that, that would be great. Let's see, let me find this next question here. Is there an intersection between your homeless services and people who have crossed the border illegally or illegally and have nowhere to live? Do you want to take that? Would you like me to?
Well, I'll kick it off, and by all means chime in. Those who are coming across the border, there are enough, and we know of them, for instance, Catholic Charities, there are enough support systems in place to help those who are coming off the border, and they do, as far as refugee services are concerned. We're not seeing an influx of individuals, of those who are coming across the border. That's not what we're seeing. And that's, I think, because, again, there are refugee services that are in place. I mentioned Catholic Charities. The other one is Jewish Family Services is another one that has federal contract dollars in order to support refugees. So that's basically what we've been seeing to date. Bill?
Yeah, I guess the only thing I would add to that is, we do serve people. We don't necessarily ask for citizenship, but we don't see a lot of that at Father Joe's. It does happen from time to time, but it's not like a major percentage of our population that we serve. And so, as Deacon Chip said, it's really not our focus.
Right.
Yeah. There's a question that says, has there been any discussion to allow graduates in fields such as healthcare, social work, et cetera, work off their college student debt by devoting 3 to 5 years working for nonprofits such as Father Joe's? I can say just in short, and I'm sure you can add much more detail to this, in short, that yes, there is some of that already available through student loan forgiveness programs. We have a number of people in our staff who do utilize those kinds of programs. I believe it's 10 years, though, if memory serves, that they need to in order to work off that student debt. But we have a number, whether it's in our health program, our health center, or in other aspects of our organization, who do take advantage of that. But maybe you have more to add to that.
No, that's it. That's basically it. I was going to mention specifically our federally qualified health center. We have some individuals there. It's very helpful.
Yeah, absolutely. No, it really is. It's key because it really does level the playing field for nonprofits like us, who probably can't afford to pay people as well as, say, a hospital system, right? And so it really does allow us, a little bit of an more even playing field, so people that are mission driven can afford to do that work. And we have had, within the health center over the years, we've had a number of people who have worked with us while they were in medical school and then eventually became long-term doctors with us because it just got under their skin, right? They loved Father Joe's, they loved the work that we did, and we're very thankful to have them. Okay. This one says, this informational opportunity addressed serious needs in our San Diego community. How many individuals were invited to this opportunity to become better informed? Seems like the two of you could go on the road and gather an army of people who want to assist. So thank you for that.
Thank you for that. You know what I would add to that, and I chuckle, I was in Alabama at the studios of EWTN, and it was hosted by Father Mitch Pacwa, actually. And the reason it comes to mind is because of this question. At the end of the session, it was an hour session. At the end, they opened up the telephone to people calling in from various areas in the United States. And so one person said, he was calling from New York, and he said, "We need you here in New York. We need Father Joe's Villages in New York." So I appreciated him saying that, and I told him, and I know New York well, obviously, since I'm a native New Yorker, and the issue. New York, by the way, for those of you who don't know, has the largest homeless population in the United States. Of the 550,000 who are homeless in the U.S., Think about that, 550,000, this great country of ours, that's a travesty. 80,000 of them are in New York, right? So they by far have the largest population. That said, I told them we have enough to do right now in San Diego, but I'd love for us to be able to expand our model elsewhere. Anyway, I thought I'd add that.
That's funny. Yeah, and just maybe a more direct answer to that question is we did invite everybody on our email distribution list, and we promoted it on social media. So we did try to get the word out as best we could. But we do these periodically. So if you see this announced again in the future, and there's somebody that you think should really be on here, then by all means forward that invitation. Or if there's somebody you'd like us to invite, please let us know. We'll be happy to extend that invitation to them.
Right.
And somebody also reminded me here that the link will be published. So we're recording this, so the link will be published afterwards as well. So anybody that couldn't attend today can access it after the fact. So that was our last question, Deacon Jim.
Okay. Well, I'll end where I began, and that's thanking you for the time that you've taken to be with us this morning, this afternoon now. I really appreciate that you do take the time. I know you're very, very busy, but you're our faithful supporters. You get it. You know that homelessness is critical. The state of homelessness is at a critical state here in San Diego, and you believe in our mission, as I mentioned, in our vision. I like to always encourage my staff to believe that we can make a difference in the world. And I mean, just believe that we can make a difference in the world. I believe that we are making a difference in the world. Is it the globe? No, but it's our world here in San Diego. And by extension, I think we are making a difference elsewhere. And people do come in and look at our model and try to replicate it. So thank you for believing that you can be a part of changing the world. And we always encourage any questions. If there's anything after this session, by all means, let us know. And with that, Bill, anything else at your end?
Nothing else. Thank you all for joining us. We really appreciate it.
God bless you. Take care.